The Bernstein Fellows that I've had the privilege of working with are really wonderful people, and they give me a great confidence that the future of healthcare in North Carolina, from a leadership perspective, is in good hands.
So many memorable and rewarding moments. Being the leader of this program is just tremendously fulfilling, but if I had to pick one, really it's that moment that I recognize that they've become friends and confidants and really enjoy being with each other and rely on each other.
Being a Bernstein Fellow for the last 2 years has been an amazing journey of self-discovery. It has helped me with honing in on my leadership skills, being confident.
It's been a unique opportunity to connect with other people around the state doing really different work.
Letting your guard down and being vulnerable with new people, letting your guard down and being vulnerable with leaders in North Carolina, and letting them work their magic to grow and develop some of your own skills.
I feel like I've been given the opportunity to really focus on who I am as a professional and who I want to become. I've been granted a great relationship with other women.
I came into this fellowship not really knowing what to expect, and have met 6 other amazing women who are all in upcoming leadership positions or current leadership positions.
I've been able to meet people across the state, leaders in healthcare that I never imagined possible at this stage in my career. And it's also allowed me some time and space away from work to really focus on my own leadership skills.
I think what really just comes through is carrying on the legacy of Jim Bernstein. And so instead of making decisions for patients and folks in rural communities, he was making decisions with. And so that thread has been carried through the fellowship.
The Bernstein Fellowship would be a great experience for rising leaders across North Carolina.
You'll get a lot more out of it than you expect to. I got a lot more out of it than I ever expected to.
And this fellowship will teach you a whole lot. It will also expose you to a lot of things that you may not otherwise be exposed to, which is incredibly valuable. You will meet people that you may not otherwise meet.
Over 2 years, you are taking yourself at times away from family or work, but there are things that I have taken with me, and there are things that I have learned and been a part of that otherwise I would have never gotten those opportunities. It has helped me to really see where I'm at now very clearly and where I want to go.
I've been in community health for 14 years, but this experience, the graciousness of the leaders who have given their time, donated their time to make us better leaders, they genuinely care about our success in the future.
I was a first-generation student. I'm the first to acquire a salary-paying job in my family, and I feel like this opportunity has given me a network that's like, you can't monetize that.
Well, that is an awful lot to follow, Mr. Secretary, Mr. Administrator, wonderful fellows. My name's Hugh Tilson, and I have this wonderful privilege of having the best volunteer job in North Carolina. I get to lead this program. David, thank you so much for this opportunity. It's truly impactful and meaningful, and I get so much out of it. Of course, couldn't do any of this without Lisa and Nell. Thank you, thank you, thank you. And Carla Obiol used to do this. I don't know if Carla's here, but if you see her, thank her too. She's amazing. I also really wanted to thank Sue Bernstein, who carved out some time this afternoon to be with us. Told stories that, I'm old, I've been hearing these stories about Jim for a long time. Never had the opportunity to really hear how they met, what they did, how they connected. It's amazing. And she told us about the life and the contributions he made to our state and our country, so that as we work through this fellowship and we do our work, we can do that consistent with and in honor of Jim's legacy. So thank you, Sue, for that, and thank you to the Bernstein family. This is a wonderful training program. I tell the fellows all the time, you get out of it what you put into it. I think you heard that they put a whole lot into it. Thank you so much for all that you did to make your leadership training real, for getting on that raft and figuring out that, whitewater rafting isn't quite so bad, although I'm not sure now is the really time to talk about that. But it was lovely. and spent a lot of time thinking about what rural really means in North Carolina, thinking about what healthcare really means in North Carolina, thinking about what policy and advocacy and leadership means. And in order to do that, we spent a lot of time with a lot of true North Carolina leaders. If you met with any of these fellows and gave us your time, will you please raise your hand so we can thank you? Thank you. One of those is my much better half, Betsy. Thank you so much for supporting me in all things that I do. Thank you. And I'm going to turn over to Randy, who's going to have the bulk of this. But Randy, you're just a true leader. Really appreciate your commitment to this. You're a great partner and become a really wonderful friend. Thank you. So Randy, talk to the fellows.
Well, I'm about to read to you a list of 7 names. You've already seen them on the big screen, and now I'm going to invite them to come up on stage so you can meet them in person. Will all the Bernstein Fellows come on stage, those that are with us tonight? And as they are... As they're arriving for Hugh and Lisa and I, they have become dear friends. For each other, they have become strong colleagues. And then what I can say now with confidence to each of you is that for you, they have become the future healthcare heroes in the state of North Carolina, because this will not be the first, this will be maybe the first time you've seen these folks, but it won't be the last time. They have developed over the course of 2 years into strong leaders. I'd like to first introduce to you Jamie Burgess Flowers, a clinical social worker serving as assistant professor and director of integrated and applied behavioral sciences at High Point University's Workman School of Dental Medicine. Jamie? Next, we have Christian Curry. Christian is a project director for the North Carolina Institute of Medicine, working on leading policy issues affecting our state, including maternal and child health and oral health. Christian, great job. Next is Dr. Brandy Harrell. Brandy is a behavioral health professional, and she developed the Kinston Community Behavioral Health Center in Kinston, and is currently FHLI's Chief of Staff. She also, I might note, serves on the Town Council of Winterville in the role of Mayor Pro Tem. Brandy. Now, the next name on our list is not with us tonight because she's serving her community in Morganton in the disaster, but Ashley Jarrett is a nurse serving as the Assistant Health Director for the Burke County Health Department, and she's been instrumental in growing the Burke Street Medicine Team, a multidisciplinary group providing primary and mental health care to people living on the streets in Burke County. Please recognize Ashley. Next is Savannah Junkins. Savannah, you got fans, Savannah? Savannah's a physician's assistant and is the Director of Integrated Behavioral Health at Freedom Hill Community Health in Tarboro, and has introduced integrated evidence-based harm reduction strategies into a primary care setting at Carolina Family Health Centers. Shaughnessy Lofton has chosen a career in public health with a deep focus on health equity issues, and she today is the Senior Project Manager at Partners in Health. Shaughnessy, congratulations. Lastly, we have Rachel Pennell. She's a clinical social worker with a special interest in suicide reduction, serving as the Director of Integrated Behavioral Health at Charlotte Community Health Clinic. Rachel. So one last round of applause to all of these future healthcare heroes.